Universal health care. Universal health care in America has come up recently and in the past. This has been brought up recently, very recently in the government, and actually Obama has actually passed a bill saying about his Obamacare. I believe that the United States needs a system of universal health care for these three reasons. That we have two different types of health care, and they relate significantly to the cost. We need to explore our history because we got to know where we came from to get to where we are today. And we have to have the government and the public support to have a universal healthcare system. I believe in the long run, the cost of universal healthcare would be way less than what we have currently today. Melissa McCullough, a researcher for the American Journal of Bioethics, found that the benefits of the universal healthcare system outweigh the downfalls. One of the biggest controversies that we have in the United States today is that we see a disillusion of what happened in the past. We have on record that there was a failure of this to work in the past. There's been a time in the 1990s where universal health care was brought up, and that did not work back then. We also see that there was not an overall public support. Today we see that many people don't show an interest in government and what we have today, so we don't actually see any progress in what we have. Melissa McCullough, again, a researcher for the American Journal of Bioethics, she also goes back and compares what the United States has and compares it to what the United Kingdom has. The government in Europe is very different than what we have, but a lot of countries in Europe, including the UK, have a universal healthcare system. She shows that the cost of what they do and what we do is a big difference, and theirs is actually less in the long run because they've had it for longer. Plus, there's also a government fallout between the Republicans and the Democrats. To get those two to support each other would be very key to what we need. Marlise Rashford, a writer for the Nursing Forum, wrote in January of 2007, "It is up to the American people to show interest, to discuss their concerns, to voice their opinions loudly, to demonstrate to politicians that this is an important issue and deserves immediate attention." So when I say we need public support in this situation, we need to actually get on board and we need to go out and speak to our politicians and find what is really right. Some of the history of United Healthcare, the healthcare in America actually, is that back in the 1960s we had a thing with the Workers' Party. The Workers' Party was mainly a group of workers that got together and said we deserve healthcare in the workplace. This is actually one of the first forms of universal healthcare. There was the national healthcare system, which was almost a complete failure in a sense. There was a lot of delusion, a lot of distillment, and it didn't go over smoothly. Alan Derrickson, an author of over 3 books and a professor at Penn State today, wrote about some of the history of healthcare in America. He described that healthcare was not available to the general in many situations, and that also caused a lot of problems in the past. Some of the United States problems today, though, is that the government happens to be kind of ignorant on the idea. Stephen Gorin was quoted in the National Healthcare about problems to reform. Healthcare in the past, Stephen Gorin was quoted in the National Health Line about problems to reform healthcare in the past and what it led to. So what that's saying is that we need to go back in the past and see that what didn't work in the past isn't going to work today if we do the same thing. Some of the problems of what we have today is that they're trying to repeat some of the things that happened in the 1990s, which also did not work, and it was almost a complete failure. Also, Robert Doherty says that the problem is that physicians are deeply divided about the ACA, Affordable Care Act, and and he quotes this in the Annals of Internal Medicine. So what we're seeing today is that a lot of our government and the actual physician, the medical physicians themselves, are divided on the topic. The reason some of the physicians are divided on it is because they see with this healthcare it's not going to cover as much, and they're going to see a lot of people coming in, and they're not going to get their full price or their full coverage of whatever medical issue it is that they're going to. A lot of like doctors in the hospital, some of that stuff, it wouldn't be paid for because the new universal healthcare system actually doesn't cover quite as much as what we have today, but the cost effect for the government in the United States in the long run is going to be better. So that brings us around to what I have to say. Brings us back to what I have to say. Universal healthcare happens to be better for the United States because I think it'll be better in the long run. I think we'll work out some of the kinks of what universal healthcare has shown. I think that the cost in the long run will help the United States because we're significantly in debt, and I believe that this will help. And I believe in the long run that this would be a lot simpler for some of our physicians. There won't be so many papers flying around if we have one universal healthcare. I think this healthcare system will be sped up. We see a lot of waiting in our universal healthcare system today. So those are three things that I believe will help. And that brings us back to like how we show the different types of healthcare with our primary and secondary care. It brings us back to the history, showing what we've done in the past and how we can improve. And it goes back to the government and public support, getting everybody on board to get our universal healthcare system to work today. Thanks for watching.